A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Assalamu alaikum and peace be with you all. I would also like to acknowledge the Daruk and Eora people who are the traditional indigenous landowners of where we meet today. Mission of Hope is a not-for-profit charity organisation that targets to address the mental health and community development needs of the Sydney Muslim community. Now, Hayat House has had a journey that started in 2004. In 2004, Mission of Hope adopted the need to hold a drug and alcohol information forum for the Muslim community. We had a few hundred people in attendance. It was widely supported, even though at the time it was seemingly controversial, because no one at the time wanted to believe that the Muslim community had a drug and alcohol problem. We designed the initiative to cater to the religious and cultural norms of the Muslim community in Sydney, because at the time there was no culturally appropriate services, education and awareness programs that targeted this very sensitive issue. So Mission of Hope was hoping at the time to close the gap where drugs and alcohol were concerned. So in 2004, whilst we had a very important program that included education and awareness, we also put forward a poster program that involved Hazm al-Masri. We made posters, we also made a billboard in order to introduce to the community why drugs was actually quite harmful. In 2008, we piloted the first ever 12-step recovery and support group for Muslim men who were struggling with substance addictions. It was the first project in Australia that targeted the cultural sensitivities of the Muslim community. The target group for the pilot group included males who were released from prison for up to 2 years on community service or also on probation. So we serviced a forensic type of population with the cultural and religious norms that were also considered. And so through our community development programs within Mission of Hope and ongoing consultations with both Muslim community and mainstream health service providers, we recognised the need for culturally and religiously appropriate drug and alcohol service that could meet the needs of the Sydney Muslim community of diverse backgrounds. We recognise the need to also provide this confidential addictions counselling, education and support services to individuals, families and the community in order to promote healthy lifestyles and also promote healthy lifestyle choices. Because if we don't provide adequate services to meet the growing needs of the diverse Muslim community, it will have a significant negative impact on persons faced with addictions, their families and the wider Muslim community as a whole and also the society in which we live. So promoting a healthy, addictions-free lifestyle will benefit the health and wellness of individuals, our families, members of the community and society as a whole. And what we need to understand is that over a quarter of Australia's population were actually born overseas, where 1 in 5 Australians also speak a second language at home. Research has shown that this is one of the reasonable outcomes of understanding these statistics is that a few of the reasons include that mainstream services do have a service that is provided on a wider scale, but what they can't attract is people from culturally and linguistically diverse communities to seek those services because of the barriers within those services. And I'll explain them in a short while. So we have, of course, the language barriers that do exist in mainstream services. So many of the alcohol and other drug services available require clients to be proficient in the English language to be able to engage or start accessing that service. There's also the issue of shame, guilt and stigma. And whilst it's not uncommon for many people to experience shame, guilt and stigma around alcohol and other drug issues, in some cultures the shame, guilt and stigma is actually heightened and acute, calling into question one's morality and bringing in both community and individual shame. There's also the issue of fear of discrimination, and it is not uncommon for people from culturally and linguistically diverse backgrounds to worry about being judged or stereotyped or disadvantaged about their personal actions. And it's important to understand that in today's Islamophobic and political climate that there will be an increase of fear of discrimination amongst Muslims. There's also the cultural and religious differences that have to be catered and adhered to, because currently mainstream alcohol and other drug services, they do adopt Western concepts that may not be readily understood by people of culturally and linguistically diverse backgrounds, and this may prove to be a deterrent from accessing these services that are incongruent to cultural and values from their own. An important factor that's also important for Hayat House is family involvement. So currently many alcohol and other drug service treatment models do not involve families of the client to be actively involved in treatment and recovery. So this may not be suitable for the client and the supportive family who prefer that their struggling family user is met with family support during treatment and recovery. So Hayat House, what it means, it means existence and life in both Arabic and Urdu. And Hayat House service, the community-based service, is a culturally appropriate community-based drugs and alcohol addictions treatment service for the Muslim community in Sydney. And the program is actually managed by a Mission of Hope committee that consists of health professionals, including psychologists, doctors, and other health workers, mental health professionals, including social workers, youth workers, and community workers, and those experienced in health administration services also. And this is to ensure that Hayat House model and service delivery meets the health regulation guidelines and is guided by evidence-based practice. And Hayat House will adopt the harm minimization model with the idea that abstinence in mind to ensure that both culturally and religiously based elements are included for best practice for our diverse Muslim population. And the aim of Hayat House is to provide a community-based centre that provides case management assessment for individuals, couples, family, and also group therapies, and case management, and other alcohol and other drug awareness programs. And the recovery may also extend for providing support for clients whilst at home or when accessing external service providers. For example, when they are engaged in detox programs, we'll provide assistance as well. And given the realities of related relapse during recovery, we aim to provide support for families to assist them with information, resources, support during their family members during their ongoing recovery. And more importantly, and this is very important for Mission of Hope and Hayat House aims and objectives, that is that we aim to assist the addict sufferers to reintegrate and reconnect back into the Muslim community to enhance their quality of life. We don't want clients to feel isolated or neglected from their own community for fear of shame, guilt, or stigma, which may fuel their drug addiction and also affect negatively their overall well-being. And we hope, that's why we're called Mission of Hope, that our evidence-based health model is infused with community reintegration will best serve the needs of the Muslim clients to reduce drug-related harm and provide a high standard of clinical care to those that access Hayat House. Again, Hayat House aims to provide the diverse Muslim community with an opportunity to have accessibility to drug and alcohol treatment program to help minimize their drug use. And with that in mind, it's also important to convey that our services will also be open to non-Muslims who wish to engage our service model. Overall, Hayat House wishes to engage individuals within the Muslim or mainstream community in enhancing their lives and enhancing the lives of clients as well as their families and providing them with a better quality of life. And Hayat House aims to support positive behavioural change in alcohol and other drug clients through the delivery of evidence-based therapeutic individual, group and family counselling, and services will range from a brief intervention, single session, to extended periods of work and psychosocial case management also. We will also aim to provide preventative awareness programs to the Muslim community and also mainstream organisations, for example, Muslim community centres, schools, universities, youth centres and also street outreach programs. The spiritual and religious intentions behind Hayat House and the initiation of Hayat House is very important for our ultimate objectives. And these ultimate objectives, of which are necessary for the Muslim community and humans as a whole, is to function peacefully in this world according to the Quran and Sunnah. And these include 5 areas, which are protection of life, protection of religion, protection of human generation and procreation, protection of intellect and mind, and lastly, protection of wealth and resources. So Hayat House hopes to reach these ultimate objectives by assisting Muslims from further harming their health and lives from addiction, with the aim to guide them towards harm minimization and abstinence from drugs and alcohol. And as well as alcohol and other drug services being a national and social issue that needs addressing, it is also, we believe, the Muslim community's responsibility to try and address the needs of our community, especially when they're requesting a religiously and culturally appropriate response to helping them abstain from drugs and alcohol. And with that in mind, it's best to also guide them through those religious principles with also adopting a health model. And what is also important and unique about Hayat House is that it's entirely a community-funded program. We did receive generous donations from individuals and Muslim organisations, and Hayat House will be based in Bankstown. And services will be provided by accredited health and social welfare professionals, including, at the moment, we have a registered psychologist and also a social worker. So the ultimate goal of Hayat House Addiction Treatment Program is to provide patients or clients with tools necessary to achieve long-term abstinence, which is consistent with the health, harm minimisation, and also cultural and religious norms, keeping those in mind towards treatment and recovery. So we hope that service providers in the Muslim community welcome Hayat House and use our service. Thank you very much.